This is Lab D, paralleling technique on the left side. This lab completes your FMS series. You're going to be doing maxillary left premolar, maxillary left molar, mandibular left premolar, mandibular left molar. For the posterior periapicals, we're using the yellow posterior bite block. We're using number 2 plate, and we're using the yellow channel on the aiming ring, and we're using the yellow prong on the indicator rod. So we're going to be using number 2 plate. Your A is going to go down in the slot of your bite block, the black side towards the biting area. So it should look like this, the A down into the slot. We're going to put a piece of tape to keep the plate in place. And we're doing maxillary left. So on your indicator rod, the angle is going to go on the opposite side of the patient. So we're going to insert the yellow prongs into the holes on the bite block. You can put it at the beginning, towards the closer to the plate, or farther out, depending on your patient. Make sure you push it all the way in. Then you're going to use the ring, the aiming ring, the yellow channel. We're going to insert it in the rod, making sure that you see the plate, making sure that the plate is in the center of your aiming ring. So it should look like this. We're going to put a cotton roll on the bottom to support the instrument in the patient's mouth. So this is a setup for the maxillary left premolar and maxillary left molar. Now I'm going to show you the setup for the lower left premolar, lower left molar periapicals. So for the maxillary, you had it positioned this way. For the mandibular, it's going to be going this way. The right angle of the indicator rod is going to go opposite side of the patient's cheek. So you're going to insert the prongs into the bite block. You're going to slide the ring through the yellow channel, making sure that the center of the plate is in the center of your aiming ring. Make sure the plate here is in the center of your ring. Then you're going to put a cotton roll on the top to stabilize your instrument. So your setup should look like this for the lower premolar on the left, lower molar on the left. Notice the difference between the two setups. On my right side is the setup for the maxillary left premolar and molar periapicals, and on my left side is the setup for the lower premolar and molar periapicals. So notice the rod is placed away from the patient's cheek. Notice the ring setup. They're both in the yellow insert, but different position. Now I'm going to show you the placement of the maxillary periapicals on the left side, molar and premolar periapicals. Always double check that the plate is in the center of your ring. So now we're going to place the plate parallel to the buccal surfaces of the molars. The middle of the plate, we're going to place the second molar. So bring your bite block on the second molar, making sure that the center of the yellow bite block is in the center of the second molar. Bring the bite block up to the teeth and close it gently, because we don't want the plate to bend on the palate. Then you're going to bring the ring close to the patient's face. So your guide is the outer canthus of the eye for the molar view. Now we're going to align our collimator. So you're going to place the tube head parallel to the aiming rod, and we're going to use the horizontal. We're going to place the four corners of the collimator into the four corners of the horizontal on your aiming ring. So you're going to place it gently, not forcing it into the four corners. Making sure the collimator is in the four corners on the top and the bottom on both sides. Now we're ready to expose it. Check your exposure chart on the window and expose the periapical. Now I'm going to show you the placement for the premolar periapical. So change the plate. Remember, the A goes in the slot, black side towards the ring. Making sure that the plate is in the center of your bite block. When you look through the ring, the plate is in the center. We're going to place the plate parallel to the buccal surfaces of your premolars, looking through the ring, placing the edge of the plate on the distal half of the canine. Close it gently. Bring the ring close to the patient's face. And your guide is the middle of the plate, middle of the pupil. Now we're going to align the collimator to the aiming ring. We're going to parallel the tube head to the aiming indicator rod. Rotate the collimator into the four corners of the ring, making sure you're in the top and the bottom on both sides. We're ready to expose it. Check your exposure chart and expose your view. Now I'm going to show you the placement of the lower premolar and molar periapical. So remember, the angle of the aiming rod is away from the patient's cheek. So we're going to place the center of the bite block on the center of your second molar on the bottom. We're going to parallel the plate to the buccal surfaces of the molars, centering the bite block on the second molar. Close it gently. And your guide is the outer canthus for your molar. Now we're going to align our collimator. Make sure the tube head here is parallel to the indicator arm. Then rotate the collimator and place it into the four corners of your ring. Making sure they're into the four corners on the top and bottom on both sides. Now we're ready to expose your molar, periapical. Check your exposures on the window. And now we're going to do the placement on the premolar, periapical. Change your plate. So for the premolar, we're going to parallel the plate, parallel to the premolar, to the buccal surface of the premolars. Remember to move the tongue out of the way if your dexter has a tongue. We're going to place the plate parallel to the premolars, looking through the ring, looking at the edge of the plate to capture the distal half of the canine. Close it gently. And your guide for the premolars is the middle of the pupil. We're going to align the collimator parallel to the aiming rod, and then we're going to place the four corners of the collimator into the four corners of the aiming ring. Double checking that they're in on the top and the bottom on both sides. We're ready to expose it.